Dear students, welcome to the lecture. Today we will talk about indications, contraindications, and complications of endodontic treatment. Indications of endodontic treatment are irreversible pulp disease, pulp necrosis, and gangrene, planned prosthodontic treatment, and dental trauma that can lead to vitality loss of the tooth. Indications of endodontic treatment: irreversible pulp disease. There is an infected pulp tissue in the pulp chamber or in the root canals. Pulp extirpation is indicated. Root canal shaping and cleaning is necessary. We need to enlarge root canal space by 3 to 4 ISO sizes from initial apical ISO size. We expect that the infection hasn't penetrated into the dentinal tubules. Shaping for 6% taper is needed to be able to fill the root canal hermetically. In case of vital extirpation, acute pulpitis when the root canal is not heavily infected, we prefer one-visit treatment option. Indications of endodontic treatment: pulp necrosis, gangrene. In the pulp chamber, we can see necrotic tissue, smelly wet liquefacted tissue, or also we can see empty pulp chamber. We expect dentinal tubules to be contaminated. Gas and pressure present in the pulp chamber can push infection deeper into the dentinal tubules. Enlargement of root canal space is necessary to the healthy tissue. We observe color and texture of dentinal tissues removed by mechanical instrumentation. Healthy dentin walls are present when we feel hard dentinal tissues during instrumentation that are not discolored. It is advised to put disinfection dressing application between visits, and two-visit treatment is preferred in case of massive infection. Indications of endodontic treatment: prosthodontic treatment. In the pulp chamber, we expect sterile environment in case of vital extirpation. This option has good prognosis. We enlarge root canal space by 3 to 4 ISO sizes from initial apical ISO size, shaping for 6% taper to fill the root canal hermetically. Before placing prosthetic work on the tooth, it is not always necessary to provide endodontic treatment, although it is usually done to prevent complications in the future, especially in the case of lower incisors and upper premolars, or due to other reasons such as improper position of the tooth. Often inclinated teeth or teeth in supraocclusion pose a problem, or insufficient hard dental tissues for placing prosthetic grafts supragingivally. It is advised to wait, usually 3 to 6 months after endodontic treatment, and place temporary prosthetic work to see if any problems do not arise, in particular after complicated endodontic treatment or large lesions treatment. Indications of endodontic treatment: dental trauma. Dental trauma can lead to pulp damage, and therefore endodontic treatment is indicated, for example, most commonly in case of horizontal tooth fracture. In case of vertical root fracture of the tooth, extraction is indicated. This condition is not treatable and root canal treatment is not indicated. Contraindications of endodontic treatment. There are social, technical, and operative contraindications. If endodontic treatment is contraindicated, usually extraction is the only option of treatment. We take notice of three main domains of contraindications of root canal treatment. Contraindications of endodontic treatment. Social contraindications are: social contraindications are concerning the patient. Endodontic treatment is often specialized and time-consuming procedure that can be too expensive for the patient. Some patients are not interested in investing into their dental work or are not able to adhere to the dental treatment plan. Patients who do not show up for a planned visit or does not comply. Root canal treatment is also non-feasible if the patient is not able to open the mouth at least on 2 fingers wide in lateral teeth. Also, patient can be mentally or physically disabled and is not capable to stay calm and still for a certain amount of time. Contraindications of endodontic treatment, technical. Technical contraindications originate from inability to access and treat the root canal successfully. For example, the root canal can have unpredictable and very complicated anatomy. Or the root canal space can be obstructed by non-removable filling, for example, wide metal post. In case of root canal blockage, periapical surgery can be provided with retrograde root canal filling, which means that if we cannot clean the root canal from the oral cavity, surgical access through alveolar bone can be made in some particular cases to clean the root apex that is often the source of infection. Or other options are to remove the whole affected tooth, root, with or without the crown part. Depending on the stage of infection, it is also possible to clean the root canal space partially to the point it is possible to clean and shape and wait if the periapical lesion will heal. If it does not heal in time of 6 months, we perceive this as a failure and tooth is indicated for extraction. Root canal space need to be filled hermetically, sealed both from the apical and coronal part. Coronally, usually the tooth needs a buildup made from some sort of adhesive type of filling, or in larger loss of hard dental tissues, the tooth is restored rather by prosthetic work. If the dentist is not experienced or appropriately equipped, it is best to either not provide endodontic treatment or to send the patient to more specialized dental office. Contraindications of endodontic treatment, operative. In case of major periodontal damage or large perioendodontic lesion that is not healing in some period of time, even with repeated application of calcium hydroxide into the root canal, the tooth is rather indicated for extraction. Deep caries of the root can pose a problem. If the caries is untreatable and dry working field for its filling cannot be secured, it has no point to treat the root canal and extraction is indicated. In most cases, if the pre-endodontic buildup is not possible to make, the tooth is considered untreatable. In some particular cases, it is possible to orthodontically pull out the tooth out of the alveolar bone and then treat the caries, but this procedure is not suitable for every case and takes time and specialized treatment. It is not commonly provided. Caries on the floor of the pulp chamber are mostly untreatable. Small perforations can be filled by calcium silicate cement with rather poor prognosis. Perforation in different areas of the root canal can pose a problem. If they are successfully filled, most commonly with calcium silicate cements below the alveolar bone, the tooth can be overall restorable. If not, it is indication for extraction. Vertical root fracture is non-treatable condition and therefore it is definite indication for extraction of the tooth. If the endodontic treatment is possible but final restoration of the tooth cannot be provided, it is also indication to extract the particular tooth. In most cases, we are talking about the teeth with poor biological factor, teeth with great loss of hard dental tissues. Root canal treatment is unnecessary to provide on teeth with no importance, like third molars or teeth that don't have antagonists. It is important to evaluate the condition of the tooth, patient overall health status, and infection load that the tooth can present. If the patient needs to get rid of focal infection from the tooth in a short period of time and the lesion is rather large, for example before planned surgery, extraction is most often advised due to the time pressure or extreme extent of infection. Complications of endodontic treatment. Complication of root canal treatment can arise from poor diagnostic procedures when root canal treatment is inadequately indicated, in case of wrong usage of instruments or their poor quality, when the operator makes procedural errors. Complications of endodontic treatment can affect different regions. Soft tissues by mechanical or chemical irritation, surrounding tissues of the treated tooth like subcutaneous emphysema or overfill to periodontium. Also, whole organism response can be provoked, for example, allergic reaction, swallowing or aspiration of the instrument. To prevent this, we take anamnestic details of a patient to know his allergies and use rubber dam correctly. If the patient has an allergy to latex, it is an option to use non-latex rubber dam. Complications of endodontic treatment itself in the root canal or pulp chamber space arise from individual steps of the procedure, which will be described in next few slides. Complications of endodontic treatment, local anesthesia. Local complications are pain, edema, bleeding, anemization, necrosis, infection, contracture of jaw or muscle nerve injury, needle breakage, insufficient or excessive numbness, soft tissues damage. General complications are loss of consciousness, side effects, toxic or allergic reaction, hypertension, tachycardia, heart ischemia, asthmatic seizure, epileptic seizure, vasomotor syncope, and others. Complications of endodontic treatment, root canal access. Too extensive or too narrow root canal access. Root canal access has to be made the right shape and adequate size. If the access is too narrow, there is a risk of leaving some of the root canals untreated, leaving contaminating tissues in the pulp chamber, higher risk of breaking the instruments. Insufficient decontamination of the pulp chamber. It is important to enlarge the opening to be able to clean all the pulp horns, remove the pulp chamber roof. Perforation or via falsa. Perforation can be intra or extra alveolar, most common in the pulp chamber floor. Fracture of the tooth. If the treatment is not indicated, there is a great loss of dental tissues or insufficient ferrule. Prevention for these complications is proper anatomy education. Before the treatment, it is advised to remove old fillings or prosthetic work, remove the caries, make full diagnostic X-ray or CBCT if necessary, then decide if the root canal treatment is indicated. During the procedure, especially in difficult cases, it is helpful to use dental loupes or microscope. Complications of endodontic treatment, pulp extirpation. Discoloration is a common complication that comes from insufficient cleaning of the pulp chamber, especially pulp horns. Also, some types of sealers, when left in the coronal part, can lead to discoloration. Extensive bleeding occurs when we do not remove the pulp to the full working length of the root canal to the physiological foramen, or when the apical foramen is too wide, or also in the case of perforation. Broken spikes of extirpation needle are not detectable even with dental microscope. It is advised to use this instrument with care, only in wide and straight canals. Last two complications, allergic reaction and arsenic necrosis of periodontium, are rather historical cases. They occur with usage of non-currently used materials like formocresol or arsenic oxide. In today's dentistry, they are considered non-ledger artists. Complications of endodontic treatment: coronal flaring, excessive or insufficient extension. Coronal flaring or its excessive extension can lead to weakening the tooth structure, straightening the root canal, stripping of the root canal wall or perforation, or even vertical fracture of the root. Coronal flaring is also very important to prevent the breakage of the instrument during mechanical preparation to ensure straight line access to the root canal. Complications of endodontic treatment: negotiating the root canal. It is really important to find all root canals that are present. Leaving even just one of them untreated can lead to reinfection of the whole root canal system. Prevention for this complication will be to make diagnostic X-ray or CBCT if necessary, good anatomy education, and patient of the operator. Dental loupes or microscope with strong lighting would be useful. Look at the picture on the right lower corner. On the pulp chamber floor, we can see lines connecting root canal openings that can help us to find root canals when we follow these lines. Achievement of full working length is necessary for thorough cleaning and shaping of the root canal. It can be difficult due to complicated anatomy, obliterations, procedural errors made previously in a case of retreatment, inclinality, and so on. Prevention for this would be patient and experienced operator, frequent use of ethylenediamine tetraacid chelating agent, or use of apex locator. Complications of endodontic treatment: chemical preparation or disinfection. Chemical preparation or disinfection is equally important as mechanical preparation. There are parts of root canal system that cannot be accessed mechanically and therefore need to be treated chemically, most often by using sodium hypochlorite or EDTA to ensure that the disinfecting agent will work properly. It is important to have good access to the apical part of the root canal. To improve the effect of disinfection, we can activate the solution by endo activator, by making the solution to flow and move, or by heating the solution to 40 degrees. Not respecting this step can lead to endodontic treatment failure. One of the most severe complications of endodontic treatment is extrusion of sodium hypochlorite over the apex or into the soft tissues in the oral cavity, emphysema, or eventually damaging the patient claws. To prevent this situation, it is necessary to respect the working length, use specialized irrigator with the opening at the side of the tip with gentle care, exercise no pressure, be careful with irrigation of the root canals with wide apical opening. In case of extrusion through the apex, it is advised to use saline solution to irrigate or to dilute the solution. We can give the patient analgesics and antibiotics to prevent further complications. In case of burning the soft tissues, we irrigate it with water and apply healing dressing or paste. Prevention would be to use always rubber dam isolation. Emphysema occurs when air gets into the tissues under the skin and in the soft tissues. This complication can be caused by using hydrogen peroxide as irrigation solution. In today's dentistry, it is not commonly used. Some of the disinfecting solution may cause discoloration of the tooth. Complications of endodontic treatment: drying the root canal. Weeping canal is a canal from which constant clear or reddish exudation is appeared. This exudate is associated with a large apical radiolucency. The tooth is difficult to treat as when opened, exudate stops, but it again reappears in the next appointment. To prevent this condition, it is advised to respect the rules for ledger artist root canal treatment, like rubber dam use, correct chemical and mechanical preparation, respecting the working length, and so on. If the canal is not dryable after a certain period of time and multiple visits, we can think of other condition like radicular cyst, which has to be surgically removed. Rarely, the part of the paper cone can tear off its tip and can be left in the periodontium. To prevent this, we use the right size of the paper cone and we respect the working length. Complications of endodontic treatment: mechanical preparation, insufficient of or over instrumentation. Insufficient mechanical preparation is the most common cause of failure of endodontic treatment because we leave infected tissues in the root canal system. It is necessary to provide good diagnostic examination, correct working length establishment, best using apex locator, then decide the right amount of enlargement of the root canal depending on the initial ISO size and stage of infection. We use hand and rotary instruments in proper manner. On the other hand, over-instrumentation can lead to fracture risk, especially in case of retreatment. Complications of endodontic treatment: mechanical preparation, zipping or zip elbow, closed zipping and zip elbow. Zipping is excessive enlargement of the apical part of the root canal. Elbow is a constriction and non-instrumented space above this enlargement. It is caused by incorrect rotary instrumentation in curved root canal or by filing movement of an instrument. To prevent this condition, it is useful to respect working length and pre-bend instrument to the right direction of the curve. It is very difficult to fill this kind of artificially instrumented space. Open zipping is the case when the apical part is not just enlarged but cut through the apex to the periodontium. Complications of endodontic treatment: ledging. Ledging is very common complication when an instrument, which is a straight, cuts into the wall in the curved root canal. It is advised to pre-bend instruments and respect the working length, irrigate and check recapitulation often. In case we want to repair already ledged canal, we pre-bend smaller instrument to the curved part of the canal and swinging motion in and out we smoothen the ledge. Complications of endodontic treatment: stripping. Stripping is cutting through inner root canal wall in the inner curvature, mostly in mesial roots of lower molars, instrumented with straight, rigid instrument. Complications of endodontic treatment: via falsa perforation or apex trepanation. Via falsa is a perforation of a root canal wall due to harsh use of rotary instruments. Most commonly, it occurs in intra-alveolar space. One of the situations can present apex trepanation when rotary instrument with a sharp tip cuts through the apical part of the root, but not in the area of the root canal apical foramen, and original apical part of the root is left untreated. Prevention would be respecting working length and curvature of the root canal, using pre-bend instruments and correct use of rotary instruments. Complications of endodontic treatment: transportation. Transportation of the root canal occurs due to harsh use of filing motion. Root canal space is transported or moved. Prevention would be to use filing technique correctly. Mechanical preparation: plaque or apical plaque. Another complication that can occur if we do not comply to the lege artis endodontic treatment procedure. Plaque or apical plaque is caused by accumulation of preparation debris if we do not irrigate or recapitulate often enough. We can remove apical plaque by inserting thin H file or K file to loosen up the debris and then to irrigate it out of the root canal. Complication of mechanical preparation: excessive apical preparation, root canal without apical stop, and preparation through the apex. Excessive apical preparation can lead to another complication: root canal without apical stop, which is much more difficult to fill. Usually, we use calcium silicate cements to obturate this kind of open apex teeth. Preparation through the apex of the tooth can irritate periodontal area and can cause pain, inflammation, or post-operative sensitivity. Prevention would be respecting working length. If necessary, we can make measuring X-ray with an instrument inserted into the canal to check the working length. In case of wide root canal with open apex, apex locator can be quite misleading. This is useful especially if we do not have microscope or dental loops. To have visual control, we can accurate ISO size of rotary and hand instruments. Complications of endodontic treatment: instrument separation or instrument breakage. Intracanal separation of endodontic instruments frequently occurs during root canal therapy. When separation or fragmentation occurs, the lodged instrument within the pulp canal often blocks proper canal cleaning, shaping, and obturation. Retrieval of the separated instrument allows unencumbered resumption of endodontic treatment. Although removing the instrument fragment is possible, many fragments cannot be removed using conservative methods. Factors such as canal curvature and overall root canal width and depth at which the instrument is separated make attempts to remove the fragment difficult or ill-advised. Efforts to remove an instrument fragment deep within the root canal space may lead to serious procedural errors such as ledging, instrument perforation, or excess thinning of the root canal wall. To prevent this complication, it is advised to use hand instruments with care, for example, H-file only with filing motion and rotary instruments with the right speed and torque. Complications of endodontic treatment: obturation. Application of the calcium hydroxide dressing, extrusion through the apex. Calcium hydroxide dressing, when administered into the periodontal area, cause strong pain and can cause necrosis. It is advised to give the patient analgesics and to administer the dressing only to the coronal part or coronal half of the root. Complications of endodontic treatment: obturation. Insufficient hermetic seal of the root canal filling in the coronal, middle, or apical part. Insufficient hermetic sealing of the root canal filling can be complicated by reinfection of the whole root canal system. Usually, it is necessary to provide retreatment after this complication. Usually good pre-endodontic buildup is a must before even start to obturate the root canal. Complications of endodontic treatment: obturation. Overfilling of sealer or gutta perca through the apex, sinusitis maxillaris. If the sealer is pushed through the apex, usually with good disinfection and lege artis root canal treatment, it does not cause any problems. If the gutta percha is overfilled through the apex, it can cause inflammatory reaction, but it does not have to be in every case. It is right to inform the patient about this complication. In some cases, problems occur. When filling the teeth in upper jaw, especially upper first or second molars, which roots can be in proximity with maxillary sinus, in case of overfilling or instrumentation through the apex, maxillary sinus can get inflamed due to filling material transported into the sinus. Complications of endodontic treatment, obturations, root fracture. Root fracture is a rare complication happening during condensation techniques or obturation, especially in roots with thin ferrule and high condensation pressure. Complications like on obturation, flare-up. A flare-up is defined as the occurrence of severe pain and swelling following an endodontic treatment appointment requiring an unscheduled visit and active treatment. Flare-up is a well-known complication that disturbs both patients and dentists. Mechanical and chemical injuries are often associated with iatrogenic factors. However, microbial injury caused by microorganisms and their products is the major and most common cause of inter-appointment flare-ups. A flare-up or infection origin can sometimes occur even though root canal procedures have been performed judiciously and carefully. Regardless of the type of the injury, the intensity of inflammatory responses is directly proportional to the intensity of tissue injury which causes inter-appointment flare-ups.